We'll now go to our next witness, Ms. Babbrah.
Thank you so much, Mrs. Chairman, Ranking Member Casey, and distinguished members of the committee. Thank you for inviting me to testify today. My name is Pooja Babbrah, and for over 2 decades, I've worked in the healthcare technology industry, primarily focused on e-prescribing and e-medication management. I'm currently a senior consultant with Point of Care Partners, the leading management consultancy focused in this space, and we've been working on real-time pharmacy benefit checks since 2014. Now, we're here today to talk about prescription price transparency, and I'll focus my comments specifically on the real-time pharmacy benefit check transaction. For your reference, I've included historical context and technical details in my written testimony. Now, I've been around long enough to remember that in the early days of e-prescribing, back in the late 1990s, and we've certainly come a long way since then with availability of electronic tools and information to help prescribers choose the most effective, appropriate, and cost-effective medication. But there's still key missing information at the point of care. The real-time pharmacy benefit check transaction is really in response to prescriber challenges at the benefit information that's being provided in the electronic health record today. Real-time pharmacy benefit check helps fill an information gap around transparency, but its value goes far beyond that. The transaction standards being developed by NCPDP, the preeminent ANSI-accredited standards development organization for prescription transactions in the ambulatory, long-term care, and post-acute care settings. The transaction can actually provide crucial information to facilitate conversations between the physicians and their patients around their medications. Now, this can include patient out-of-pocket costs, any alternative medications that may be more affordable for the patient, the best place to fill their prescription, and also insights into additional requirements that may be required, such as prior authorizations. Now, the goal around this is to provide more accurate information about the patient's prescription coverage and the cost of their medication in the physician office as opposed to having the sticker shock at the pharmacy counter. Now, studies have shown that cost is the #1 reason that patients are abandoning their prescriptions and not adhering to their medication treatments. In other words, the provider prescribes a medication, but the patient doesn't fill the prescription, or the patient fills a medication and then only takes a partial dose because it's too expensive to get a refill. And we heard some of those stories yesterday from the patient testimonies. Now, both of these scenarios will likely lead to greater healthcare costs down the road, leading to additional office visits, unwanted ER visits, and potential hospitalization. But by providing insights into the cost of the medication to the prescriber, we believe that real-time pharmacy benefit check will enable prescribers to ensure that the prescriptions that are written actually get filled and the patients are taking them as prescribed, which will in turn lead to greater public health. Now, there are a few shortfalls with the real-time pharmacy benefit check as it's being deployed today, including the lack of information about potential cost savings, discount programs, and other financial support programs. It's also important to note that the transaction only provides the pricing on a patient's pharmacy benefit, not their medical benefit. And often expensive specialty medications are actually covered under the medical benefit, and the real-time pharmacy benefit transaction will not show that pricing. Use of the real-time pharmacy benefit check is also somewhat limited in scope today. It's primarily used by prescribers through their electronic health records. And we believe that it's important to expand the reach of this transaction to the patient and the patient caregivers. Finally, we believe the real-time pharmacy benefit check should be expanded to incorporate additional information related to patient out-of-pocket costs for the drug. Specifically, patients and their caregivers should have information that will help them determine whether they should obtain their medication under their prescription benefit or pay cash at the pharmacy. Tremendous progress has been made with the development and utilization of the real-time pharmacy benefit check, but to date, the business cases have been focused on payers, PBMs, and the providers. And we're confident that widespread use of the transaction will yield a public health gain while at the same time enabling patients to receive their medications at the lowest possible cost. I thank you for the opportunity to testify today, and I'd be happy to answer your questions.
Thank you very much, Ms. Babbrah. Very much appreciate your being here today.
Why can't we have an Expedia.com of prescription drugs? So even if you're trying to get it from a pharmacy, you can at least look at when your doctor says, which one should I send it to? And the answer is like, I don't know, this one, or this one, that you can actually look and see which one is going to be the cheapest for me, and then send it there. Like, what barriers do we need to just provide that basic transparency so people can shop around? Anybody want to jump in on that?
So I'll take that. So the real-time pharmacy benefit check that we now can offer to physicians is currently available between the PBM and the physician in their electronic health record. But part of the issue with that is it's only giving you the cost that under insurance. So
Right.
It's great information, and the workflow today is you do usually have a favorite pharmacy that you're going to. So when the physician checks that price, it's going to show you the price at that specific pharmacy under the insurance coverage. But we're actually working, there's an organization called the Karen Alliance, which is a bipartisan organization that's looking to bring this real-time pharmacy benefit check to the patients.
Right, exactly.
And as we heard, the cash price may actually be better than what's covered under your insurance.
Exactly.
And so you would be able to, basically shop around, figure out that cash price. But then the other piece is, if you pay cash at the pharmacy today, the insurance company may not know that. So we really need to be looking to close that loop, because they may not know that you've actually picked up that medication.
Right.
How do we get a paternalistic system, the people that have been using it, to embrace transparency when you've got things like copays? Any of the panel that would feel comfortable answering that?
So I think the first step in that is just helping the patients understand and the caregivers understand even what they're going to pay. I think we heard yesterday just a lot of confusion about, I get to the pharmacy and I don't even know what I'm going to pay that month. So I think part of it is just giving the tools to the patients and the caregivers to even understand what they're going to be paying out of pocket. And once you do that, then you can start, maybe putting in some of those incentives or things that will actually get them more skin in the game. But I think at this point, there's just so much confusion out there that you're not even going to get to that point that you want to get to yet.
So most plans do have copays. And if a copay is only $10 or $20, do you think they'll even make the effort of trying to shop around?
I think at that price, maybe it's not worth it, but I think we're hearing enough, and with more of the specialty medications that are coming into the market, you're seeing more and more of those copays, and you're also, with the high deductible plans, even when you have a low copay, it's not necessarily, to me, I think the plans have changed enough that you're not even seeing those low copays anymore, just because of so many of the high deductible plans that are out there.
Okay.
We know now that CMS has recently announced they're going to be making some improvements. If you were designing or itemizing recommendations this committee could make to CMS as they consider those improvements, what would you recommend or suggest to us?
I would just add, and again, I know you're focused on the dashboard for Medicare, but there's the problem that we're facing with on the real-time benefit check is, at least on the commercial payers, is the patient out-of-pocket cost isn't standardized, and so that's one thing I think that you would want to make sure is, depending on which plan you're looking at, the standard that you standardize the patient out-of-pocket cost information. But also, I want to point out the specialty meds. Again, I'm not quite sure exactly how that's covered with Medicare, but if it's covered under the medical benefit, you want to make sure that information is available as well.
Mm-hmm.